Assalamu alaikum. Starting our communication day today with Mr. David, 68 years, with recurrent admission with aspiration. At this time, the consultant decided to start alternative feeding option. He will sit with the son of Mr. David and address his concern. We will start after the timer share. Okay, here you go.
Okay. Hello, sir. I'm Dr. Ali, one of the doctors in this clinic today. Can I confirm you are Mr. John, son of Mr. David, 68 years old?
Yes, hello. Yes,
Okay. So, Mr. John, actually, I came here today to discuss about your father's health condition. Is it okay for you?
yes, doctor.
First of all, I want to know that are you next to the clinic of your father?
Yes,
I assume that you take permission from your father to discussion about his health condition. Is it?
yes, doctor.
Okay, so Mr. John, can you tell me that what you know about your father's health condition, please?
Yes, doctor. My father actually is a known case of this Parkinson disease, and he's on medication, and he's stable in his medication. But unfortunately, recently he had multiple attack of
Mm-hmm.
this bug infection in his chest, and
Mm-hmm.
before 3 days we came here, and also this is the same,
Mm-hmm.
and I feel now he's okay
Mm-hmm. I
from
highly
this
appreciate
bug
your
infection.
yes, I highly appreciate your knowledge and concern, Mr. John, about your father. So I want to discuss regarding about this condition. So, do you want to keep anybody in our meeting today?
No, I'm okay.
Okay. So, what's your expectation from our meeting today?
I'm expected we will discharge him because now I feel he's okay.
Okay, I highly appreciate your concern, Mr. John. Yes, that your father, as you know, that he has history of the Parkinson disease, and the current actually history of the disease something food goes to the his food pipe and also then to the lungs, and it's repeated time causes some infection. So regarding in that situation, actually our team, we assessed his condition, and we decided actually if we are continuing in this way, food, I mean in the normal way, so it will cause repeated infection. I mean lung infection and food goes to the food pipe and lungs, and it can cause repeated infection to the lung, which can actually damage his lung, and even it can spread to the other organ, and even it can be life-threatening. Are you with me, Mr. John?
Yes, doctor.
So actually, in that situation, to prevent this repeated type of the infection and the repeated damage of the lung, actually our consultant of our team decided to start another type of the feeding. I mean, another way to supply the food.
Mm-hmm.
Are you with me now?
Yes.
Okay. Do you have any idea that what other type of the supply way of the food
No.
do you know? Okay. So if you give me chance, I can explain it more. Can you talk it for
Yes,
you?
please.
Okay, so actually, when you know that in the Parkinson condition, actually that our brain and also our muscle function, I mean our breathing and also sometimes our taking of the food way, I mean the muscle who are taking the sensation for carrying the food, actually it's sometimes not properly controlled. So in that situation, actually, if we are giving the food in this normal way, I mean by the mouth, it can causes damage, as I told you previously. So in that situation, actually, there are some other options to give the food. So there is a one option is we are calling it nasogastric tube. I mean there is a pipe inserted through the nose and it goes to the stomach. And another way, there is a we are calling PEG tube. I mean, this is percutaneous gastrostomy tube. So in that way, we are by special imaging, we will put a special tube to the stomach, and from the outside of the skin, we are making it tight by our special knob, so it will not dislodge. Are you with me now?
Yes, doctor, I'm with you.
Yes. So in this two way, actually, you can supply the food and it can goes to the stomach, I mean to the tummy. So there is a no chance to go to the lungs. So there is two other ways. I just inform you about these two other, and later we decide which is better option for you. Do you have any question regarding that issues?
Actually, doctor, how you fix it that tube? Actually, doctor, my father, he cannot tolerate this. And how you'll fix it that tube?
I highly appreciate your concern, Mr. John. Actually, this tube actually fixing by our special team who are actually very much expert regarding these things, and they read it multiple times. Actually, two way, as I said, that you said that through the nose we are inserting tube and it goes through the stomach. This is the easiest way. But what are the another procedure we are calling it stage tube after in the stomach, the tube. So by this way, we need actually a special camera pipe containing camera. Under this camera guideline, we will insert the tube, and later we will fix by numbing the skin from the outside, and we will fix the tube with the stomach, and we will supply the food to the pipe from the outside. So there is a two-way. So if this way, we will later decide which is better for him. So for the prevention of the infection, we can do these things. And also, I just want to tell you that as we look at every procedure has there is some the complication can arise. I mean, it can cause some infection, some bleeding. Sometimes it's pain. But I can assure you that it's done by our specialist team, and we are regular follow-upping him to see it's properly working or not. Are you getting my point?
Yes, doctor. But I'm not sure. My
Yes.
father is weak, doctor. I don't know. Maybe he didn't tolerate to fix his
Mm,
tube under this camera test.
yes, yes.
He's weak,
I highly,
but I will try to feed him oral, doctor.
Mhm. I highly appreciate your concern, Mr. John. Actually, he is, I just want to assure you, he is now in a stable condition. And also want to tell you that if actually we avoid these procedures and we are giving in the normal way food, so it will be more injurious and it can danger even his life. Are you with me now?
Yes,
Can I ask some other question?
yes.
With whom your father is living at the home?
Actually, my father live alone.
I'm really sorry about that. So we can involve some social worker so they can help you because you need actually take care as we have history of the Parkinsonism and also there is a problem with that food maintenance. So they can help and we can also provide a specialist nurse, a district nurse. They can also give this training and help them. And I just want to know that your father, what's their profession? He's doing anything now?
No.
Okay.
2 minutes.
And okay. So do you have any other more concern?
Can I feed him oral, doctor?
I highly appreciate your concern. I understand that you don't want to go something other way, but also at the same time, I just want to assure you that if you are going to the normal way, I mean by the mouth, as I said, it can more complicated. Actually, as your father repeated times has infection, and again we tried this, so it will endanger even his life. Are you understand? And I just want to assure you, we are beside with your father. We are not giving only that feeding tube and we let him
Okay,
alone, not like that. We will give all of our support and we will regular monitor your father. And if we think, if we, our assessment is, we saw that he cannot tolerate, we can go in the other way. So I think don't worry about the issue.
okay,
I can give you some brochure and leaflet and some of our contact numbers. So you can read brochure and leaflet about the alternative way And then the same time, I will give you that our contact number so you can contact with us anytime. Can I
Okay,
ask
okay.
some other question, please? Do your father
Yes.
smoke? Smoke?
No, no.
Do your father take alcohol?
No, not too much, doctor.
Okay, it's under the social limit.
Yes.
Okay, it's good. Do you have any other more concern?
No, doctor. No,
Okay.
thank you.
So today I told you about your father's condition and what happened if we are not putting that another way of the feeding. What can happen? I mean, the further repeated infection can danger his life. So you get all of my point.
Yes.
Do you have any other more query?
No, thank you.
Okay, time is up. Thank you,
Well,
Dr.
welcome.
Dave.
Welcome.
Yeah, thank you so much. Well done. Let's hear Dr. Mike then.
Yes, actually, the scenario, you need in the scenario first to briefly tell him about the aspiration pneumonia, and then he give you this is a feeding open so that you to be aware of the refusing of the patient. Tell him you have three type of feeding tube, nasogastric tube, and then NG tube, and then big tube, and then a red tube, so that give the patient briefly about NG tube, big tube, and radiation, make it at the end. So, and give the benefit and the side benefit, and good benefit and bad benefit, and let the patient in this point, I suggest patient he can choose. But if you give him only one way, he will refuse it and refuse it. Again, if the patient he said to you, the son said to you, my father is weak, tell him even your father is weak, he need to feed. To if he is feeding, he become. But if you try to feed him orally, even small bees or small a cup of water, they make infection, and this infection becomes serious and difficult to treat. So that better for him to feeding by this method, and give him the advantage and disadvantage. Otherwise, you do it. Really, you cover everything in the scenario.
Yeah, thank you, Dr. Mike. So I will try to talk brief about the comment. I will feedback from Dr. Tanvir. He did well, actually. Introduction on the next of kin, the invitation. But the explanation he explained well, but he didn't, as you said, he didn't give option. Although it was written there that you give options. So as Dr. Mai said, you can give three options.
I
And
gave
he
option,
chose.
Dr. Basil. I gave option about both NG
Okay.
tube and also both peg tube, and I told that NG tube given by nose and peg tube
Okay.
given by endoscopy pipe. And its advantage if not given, so it
Yeah,
can
yeah.
causes repeated infection, can endanger even life. And what
Yeah,
are
and
the
it's
side effects
short.
like bleeding, infection, injury to the other organ? I gave all advantage and disadvantage also.
Yes, yes, I agree. Okay. Then the consent only, you miss the consent. You can tell him take the consent, read it carefully about which option you will choose, and you will sign at the end, and you can withdraw. Of course, after permission of Mr. David, because I think his capacity is still preserved. So you can tell him, read the consent well, and take the choice with decision or permission from Mr. David. Apart from this, you cover all the point, the numbness, the preparation before and after, and the risk and the complication, the failure, and side effects, dislodgement, or possible side effect or possible unwanted effect post surgery, which is dislodgement of the tube. How to fix, but you can also add the educator nurse or specialized nurse, how to educate you and to teach you how to deal with this tube and how to prevent the infection and the cleaning.
Oh, yeah.
Sorry?
Okay, Dr. Majid, your sound is muffled if you are talking.
No, this is not me. I'm close my mic.
Okay, okay, thank you. Then the social, I think the question for smoking here, I don't think the patient can smoke in Parkinson. I don't know. You can ask about smoking or anyway, the dependency, who's
Actually,
dependent.
alcohol I asked because as alcohol
Yeah,
itself
alcohol.
is
Okay,
the
yeah,
cause of
yeah,
the aspiration pneumonia.
yes,
Itself is
yes,
the
I
cause
agree.
of the aspiration pneumonia. And
Yeah, I agree.
smoking I asked as just as the relation with the alcohol actually.
Yes, agree. Yes.
And
Okay.
another thing is regarding that specialist nurse I involved already because I understand that he don't want to go something. That's why I told our specialist district nurse will help you and will teach your father how to manage this.
Okay, if you
And
involve, maybe
I
I
have
didn't
one
hear it.
question.
Okay.
Yes, and I have one question that actually, as Mr. David so far we understand, he is actually compliant. So actually, he will take the decision. Mr. John, I mean,
Exactly.
some
Yes.
cannot take the decision. We can
Yes,
invite that
yes.
we can discuss your father, and as your father has full capacity to the decision,
Exactly.
in the
Yes.
next meeting, your father we can present and we can explain it. But I
Exactly.
think
Yes.
Mr. John should not give the decision about that thing.
Yeah, no, I said he will sit and the permission will be taken from his father. Maybe he cannot to sign
Yes,
the
yes,
consent, but yeah, the decision
yes,
will
yes,
be from the father. This is tricky
yes,
point in any procedure related to the father or the
yes,
patient with a certain disease. He might be also dementic. The Parkinson also can be
yes,
or yeah. So,
yes,
but the best way is to sit with his father and to explain and to get the signature for the consent at the end. And he has the right to draw or withdraw anytime if he change the mind. Plus the live, yeah, the complication of giving him oral intake, yeah, as you explained, it might endanger his life. I agree with you. So for me, you cover all the point in this scenario. So well done. We can move to the next scenario. You can write the scenario for Dr. May.
I have
Yeah,
Dr. Basim. I have a question because
yeah, sure.
his father is now stable, but to assess the complaint, I mean, his father is mentally able to understand these things. We need to actually sit with his father, and until we will sit with his father, we cannot take decision about the consent because we don't know about the mental condition of his father because Parkinson itself it can
Yes,
cause a
That
exactly.
cognitive impairment and son
exactly,
should
exactly.
not and son don't have the right to give the permission and consent about the peg tube or NG tube. So I think we can invite that in the next time we will sit with your father, we'll assess his mental condition, and if we think that he is able to take his decision, and later he will make the side consent, and he can withdraw anytime. But until we will sit, we'll assess his function. I think we should not offer about that consent signed paper. What do you
Yeah,
think?
I agree. I agree. Yes, we will give him that consent and will let him sit with Mr. David, and according to his mental capacity, he
Yes,
will
yes,
take the
exactly.
decision. And I think with his tremor, he will not be able to sign or to hold the pen
Exactly.
apart from his yes conscious or cognitive function. So both of them will take the decision. If the father is
Yes.
okay, has the
Best
capacity, so he
interest.
can
And
decide.
later we'll
Exactly.
go for best interest. We'll go. First we'll
Exactly.
assess. If he complains, he
Yes,
will make
exactly.
the sign. He can withdraw. But if we think that he is not complain, so that time we can go for best interest.
Yes, exactly. Yes, I agree. Thank you, Dr. Deer, for clarifying this point. Yeah. Any question regarding this scenario? You can write your scenario, please, Dr. Deer, for
Okay,
Dr.
I
May.
will share in the group, please.
Okay. Any comments, any question from others? Yes, Dr. Noor, a good question to ask. And yeah, suppose to wait for this question because it might be raised in this scenario. But for me, I will not raise it because the patient still stays stable and his capacity is there, and he might live long with this disease. But in certain situation, he might lose the capacity. So we can ask about the lasting power of attorney and who can take decision on behalf of Mr. David. So the only thing we can ask is the lasting power of attorney because he might lose his capacity in the coming. But for me, I will not ask because he might live long after this with this. I mean, with this complication or with this condition. This is my opinion also. But yeah, if someone supposed to be this issue will not come. For me, I will not ask it.
Yes, yes. Actually, this patient is now stable and he has still the aspiration pneumonia. He is not under the palliative care, not under the terminal stage of care. So supposed to be,
Yeah,
I think we should not ask about the lasting power of attorney like that.
he might live long.
This is
Yes,
my
this is
opinion.
my opinion.
Yes,
Yes,
yes.
yeah.
Because lots of people by NG tube are living long.
Yeah, exactly.
Okay, Dr. Basim, I shared in the group the
Yes,
scenario.
yes. I will share it to here. I will copy and I will share it. Dr. May, you can read the scenario. You saw the scenario?
Yes. خلينا نقرأه Okay. Miss Leila, 23 years old, was admitted with a day 2 days ago with a suicide attempt. And after an intake of 20 tablets of paracetamol, initial blood investigation done for she come back as normal. She is asking for discharge. You are the senior house officer in the medical department on call today. The nurse in charge called you to talk with Miss Leila.
Okay, take 2 minutes, then we will start.
Okay.
Dr. Nora, let's clarify the point also for lasting law of attorney and the advanced directive. If the scenario mentioned that Mr. David condition is progressively worsened and he's with multiple admission to the hospital, comorbidity, something explain that his conscious or sorry, his condition is deteriorating in the last days or last months, you can raise this issue. But I feel in this scenario like Mr. David condition is stable. Only he's coming with the recurrent aspiration due to difficult swallowing. But if the scenario is showing that Mr. David's condition is progressively worse, multiple admission to ICU, comorbidity like end-stage renal disease or some other disease like COPD, respiratory failure on oxygen, along with Parkinson and dementia. If you feel like the patient condition is deteriorating and the scenario showing that, you can ask this point. As long as Mr. David is stable and he can take decision and communicate, so I feel this scenario is not suitable to raise this issue. But if you feel that the scenario is worsening or condition is worsening, so you can raise it up. Okay. Yes, he can still have the capacity assist. Yeah. But in the coming meeting, for example, if his condition is deteriorating, he's losing the capacity. So that time we can ask for these points. I hope it's clear. Thank you, Dr. Noor, for this question. Okay, Dr. Mayridi?
Yes. Yes, hello.
Yes, Dr. Basim started the timer. That's right.
Okay.
Yes, here you go. You can start.
Yes, hello.
Okay.
My name is Dr. Ahmed. I'm the senior house officer in the medical unit today. May I confirm I talk with Ms. Leila, 23 years old?
Yes, doctor.
Ms. Leila, we are here to discuss some issue related to your health condition. Is okay for you?
It's okay, doctor.
And be sure this meeting is come confidentially, and my full attention with you, and I will address it your concern. Is okay?
Yes, doctor. It's okay.
And yes, so Ms. Leila, can you tell me so far how much you know about your health condition?
Your voice is broken. Your voice is broken, Dr. Right?
I hear you well, Dr. Tanfir.
Yeah, it's well, Dr. Tavir. You can continue.
Dr.
Hello,
Basim, you
Dr.
hear me?
Tavir. Yes, we are hearing you, Dr. May. Dr. Tavir, you can hear us? I think the problem from Dr. Tavir's side. Dr. Tavir,
Yes.
you can hear us now?
Yes. Yes. Now
So
I can hear.
okay,
Yes, now I can hear.
we will start the time. By the way, Dr. May,
Okay.
Irish exam, so it will
Okay.
be 6 minutes only. 6 minutes, huh? Okay, we will set the time. Okay.
Hello, my name is Dr. Ahmed. I'm the doctor in the unit today. May I confirm I'm the senior house officer in the unit today. May I confirm I talk to Ms. Leila, 23 years old?
Yes, doctor.
Ms. Leila, we are here to discuss some issue related to your health condition. It is okay for you?
It's okay, doctor.
So be sure this meeting became confidentially, and I will admit it and address it all your concern. It's okay?
It's okay, doctor.
And can you tell me so far how much you know about your health condition?
Actually, doctor, I took some tablet, paracetamol tablet, I think 20 tablet, due to some issues, actually, my personal issues. And later I was admitted in the hospital, and now I am feeling better. They did some investigation. They said, yes, I am now in good condition. So I now want to go actually home, please. Please arrange for me
Yeah.
home.
Okay. I'm sorry for your happening, and I'm happy to hear that you are okay now. Did you have any expectation of our meeting?
Yes, my only one expectation, I will go to now home.
I highly appreciated your concern, Miss Leila, and let me just to sit with you and talking purely regarding that you came in the hospital with this tablet. Can I ask you, did you take this tablet at one time or in different time?
No, I took it sometime.
Did you take any medicine with it?
No.
Did you drink alcohol with it?
No.
Did you have any planning? You write like any planning paper you want to take this tablet?
No, I don't have any plan.
Do you have any suicide attempt in before?
No, doctor, this is the first time actually.
Mhm, mhm. Did you have any family history of suicide attempt?
No,
Mhm. Do you feel still your life is precious for you?
I am now actually, doctor, I am confusing now. I don't know what will happen in the future
May I know why?
because now my mental condition is not good, doctor. I think it will take time.
I'm sorry for you, Miss Leila. Can I ask you, did you have any stress in your life?
Yes, there is some problem in my study life and also in my family. I'm trying to cope it.
I'm sorry for that, and I will offer some social support. And if you want that, how you feel about that?
No, as I said you, I'm not feeling good, doctor. I feel some anxious, some depression. I want to go home, please. Please arrange for me going home.
I highly appreciated that, Miss Leila. And did you close the door when you take that tablet?
Yes, I just slightly close.
And how this it ended? Who's opened the door? Did you call for help?
No, actually, yes, I feel unwell. That time I little shout, and my family member was there. They pressed the door and opened it.
Did you feel guilty after that attempt?
Yes, I feel little guilty.
I'm sorry, Miss Leila, for your happening for you. And yes, your a level of paracetamol in your blood, it is normal. But I'm sorry to telling you that that level of paracetamol sometimes it affected some organ in your body, and this will take time, like your liver and your kidney, and so that and even your mood. And regarding that. We needed to observe you in our hospital, and we need to assess it by the mood doctor. How feel about that?
Doctor, as my condition is, it's okay. So, wow, mood doctor, what he will do for me? I'm not a mad person. Why you think I am mad? No need of mood
No, you
doctor
are
for me.
no, you are not mad. Mood doctor or one of the part of the specialist doctor in the hospital, and this mood doctor can assess your mood, can help it you, and even sometimes can search for any social and source, and can try to sort some solution for your this is a low mood. How you feel about that?
I am feeling now my some anxious and mood, some disturbance. So I think if I go home, I will feel better.
I highly appreciated your concern, Miss Leila. But to be assessed by a mood doctor, it is become good, and we wanted to be sure this is will not attempt will not happen again, and it's good for you. It's okay for you.
Okay, we'll see. I think.
Okay. Did you have any other concern?
Yes, doctor. That
Mm.
actually I don't know that what will happen in the future because I take already tablet. I am now worried. It can damage of my brain or some other organ, like I will die or something.
Uh, I highly appreciate your concern, Ms. Leila, and about the result of your blood shows that you didn't have the level of paracetamol in your blood. It is normal, and sometimes yes, this is affected. Can take time to affect your liver and kidney and other organ in your body, but be sure when you are here, we do our proper plan. I will give you a proper care and management and will support you. It is okay for you.
It's okay, doctor.
Did you
Okay,
have another concern?
it's okay, doctor.
Thank you, Miss Leila. May I ask you time up? Okay.
Yes, I
Uh,
added 1 more minute. You can offer some liquid before.
Yes, yes.
okay.
You can 1 minute. You
Yeah.
can ask something.
Yeah, yeah. Did you smoke?
Yes, I'm smoking.
How many cigarettes for how long?
like 5 cigarettes for last 5 years.
I need from you to stop smoking. If you agree, I will refer you to a smoking cessation clinic to help you regardless. Did you drink alcohol?
Occasionally.
Mhm. And did you have any over-counter or illicit medication?
No doctors.
Okay. Miss, whom you live, Miss Leila?
I'm living with my family, my father, mother, brother.
And how your relationship between you and your friend and your family?
So okay, sometimes my family making problem with my lifestyle.
If you agree, I will refer you to social worker to help you regardless. How you feel about that?
Okay, but social worker, what they will do for that?
If you agree, they will sit you, and if you agree, they will do meeting with you and your family. I will try to find any solution for that. Is it okay for you?
Okay, doctor.
Okay.
Okay.
And I will give you. Okay. Thank you, Miss
Okay, 2
Leila.
minutes more. Yes, yeah. Time is up.
Yes, yes,
So
yes, yes.
yeah, let's hear the
Long
comment from
scenario.
Dr. Tanvir.
Yes, yes.
Yes, difficult also. Okay, let's hear Dr. Tanvir comment.
Yes, sure. Yes, Dr. Mai, you did well. Actually, it's a little difficult. You did finish within 6 minutes. But you did well. And just some point I need to mention you. As Miss Laila, young age and already took paracetamol. Yes, you started well. You asked that introduction, confirmation, and what about now condition? How I'm feeling now? Because now I'm actually mentally depressed, suicidal attempts. So you need to ask that what about my present mood now? Okay, because you are starting to talking with me. I am competent or not competent. You need to ask by some question. And after that, you will ask about that suicidal attempts. Yes, you asked everything. There is actually like if you make it little division, like what happened before, what happened during, or what happened after. Like this type of the things, why you think to suicide, like why you are going for attempt for suicide, and this is first time, or previously you tried also. Did you write any note? You ask these things and how many tablets you take, with this tablet you took, any other medication or alcohol you already asked and got closed or not from inside. Did you ask for any help? And do you have still any plan for future suicide? Still you are asking for, you are thinking this is life is precious for you. So you ask this question. This is the good thing, first thing. And the second important thing, actually, I am insisting now to go home, so you need to ask why you want to go home. Can you tell me, please, if you don't mind? This is very important question because you need to rule out for what purpose I want to go now. So maybe he can tell you that I'm not feeling better here. The room is not good condition. The food is not good, and the staff behavior is bad with me. And I want to do a smoke, but there is no smoking center here. It's difficult for me. So he can tell you multiple issues. Even if married or something, even have children, can tell nobody for taking care of my children. So there is a multiple issue you need to solve. Like if their step behavior is not good, okay, I will ask, talk with the nursing in charge. And if food is not good, okay, I will talk with that the main chef of the hospital. Or if he don't if he don't like here to stay, that he cannot smoke. Okay, so that time you need to counseling about smoking is injurious for health. So we can refer to you as smoking cessation clinic if you want. So you need to solve this type of the question. And then you need to tell, you already told that yes, now your result is good. But I just want to tell you that it can be good for the first 2 to 3 days, but it can happen later, some problem. I mean, your kidney, liver may be not working properly, and even it can damage. Even we need to go for liver transplantation. And also at the same time, your kidney maybe will damage and it cannot function. And if liver not working properly, it can cause some bleeding and easily bleeding to your skin, and that factor to stop the bleeding, it will be less. That time it can increase the acidity of the blood, which will impair your mental function. So for that purpose, actually, you need to admit and observe in our best care, and we need to follow up you, because if this condition is sent to you, it can injurious to your life. Even it will be difficult to come back again hospital with that life-threatening condition. So what purpose we need to stay him, and if we discharge, it can cause us more something problem. We need to explain that things. And later, yes, you involve that mood doctor, psychiatrist, that will inform our neurologist and also our psychiatrist doctor and consultant to assess you. Because in that situation, actually, we need to assess you. We need to help you as you are now in the depressed and stress condition. Our mood doctor need to assess you. That then patient maybe can tell doctor what you think I mad or not. So you can tell that actually mood doctor does not mean always that it's for mad person. It actually it will establish he will stabilize your mood. He can help you to stabilize your mood. So actually in this situation we need to assess you. And actually patient can insist you lots of time that he don't want to stay, he want to go here. But this is important legal issue. Patient cannot go without assessment by the psychiatrist doctor. Even if he refused, we can go by like in the legal issue mental health act, like under doctor or under nurse. He can be detained here for 6 hours by the nurse or by the doctor 72 hours. And within this time, we need to assess, we need to make assessment by our psychiatrist doctor. So he need to, even he cannot go by Lama. He need to stay here. And you ask about the social history. Yes, you forget to ask one thing, that what's my profession? Because I am a student. It's making some problem in my study life and my social life, and also my family life, some stress. You ask about the family. I said yes, there is some problem in my family, but also need to ask about the profession. It can making a problem in my job, and it can affecting my job. So you need to involve that occupational worker, or you can give me some sick leave, or even if there is this, I am a student, so also making problem with my study. So you need to also involve there to help me. And later, let's let Bushia check understanding what I understand. So these are, I think, my comments. Thank you. Doctor.
Yeah, thank you, Dr. Tanvir. Well, good scenario and the high yield scenario in the exam, yes. Well done, Dr. Mai. As Dr. Tanvir said, as a comment for suicidal, any suicidal scenario. So you will start as you did, introduction, and the confidentiality from the start is very important, as you did, to assure the confidentiality of this meeting from the start. Then the circumstances as you did, or the condition, what you know about your condition and the expectation. Then the circumstances as you ask, how did you take, how many, along with any other medication, along with alcohol, and closing the door, calling for help, any paper or any, you wrote any paper before doing that. Yeah, all this important to do before deciding if she is at risk to repeat this action. Actually, in her scenario, yes, it's risky to leave her go home, and the best issue to do, or the best thing to do, is to refer her to more doctor to sit with her and to assess her more regarding or related to her mental health act and possible discharge. If the patient insists to go home, as Dr. Tanvir said, you have the right to detain her, but don't reach to this level of confrontation. Try to talk by convincing. Not by confrontation or by confronting her, because it might lead to another fight, and you will be in trouble if the patient left the room or left the discussion. So try to make it like calm and uh, I mean, be calm the patient. Don't be aggressive and detain her by force. Do it in a convincing way. We are afraid your condition, your life is precious for us, as it's precious for you and your family, as Dr. Lai did. But again, the scenario, don't ask about illicit drug. You can ask only on the history and the communication about smoking and alcohol, not illicit drug. You cannot ask about illicit drug. Social, you can ask about the job and the smoking alcohol as you did, but don't exceed more in the question. Don't ask about the I mean the illicit drug. It's not accepted to ask. It will be considered as history taking. This is regarding to the social. Then you can offer social support, yes, as you did. If you have any stressful condition in your life, we can help you with our social team. We can help you in this regard. I think yes, this question is covered well by Dr. May and Dr. Tanvir as well. Any question for this scenario or the previous scenario? For Dr. Tanvir scenario, the first scenario, you are when the you ask the son, did Mr. David live alone or who's living with him? He said he's living alone. I think you can't. It's not wise to involve the social worker from the first trial of help. You can involve any family member to sit with Mr. David. You have anyone can sit with him, can help him at home before offering social worker because they are saying that social worker are not free to help everyone. So the family member or the family should be, yes, I am. Okay, you got it. Okay. So better to involve any family member before offering social work to help with the patient. Yes, agree. Okay. Thank you, Dr. Tanvir. If blood level is normal, so still warning about liver failure. By the way, Dr. Nora, it's not related only to the liver or to the kidney or the late or delay effect of the medication. It's related to her mental health act because it seems that she will try again to suicide or to end her life. Okay, so try to convince her not to go home at this time to be assessed again by our mood doctor before giving her the decision to discharge. And you can also warn her about the late effect and delay response to the medication or paracetamol toxicity. You can do like that. Okay. But it's not only the concept of normal blood level. So it's related to the mental health act. Okay. Any other question? Any concern? Any comment? Okay. If no more comment, no question, we can end this session. Thank you all for attending. We'll see you tomorrow. Good luck and good night. Assalamu alaikum.